I did my research paper over ADHD. A lot of people in my age group have ADHD, or signs and symptoms of it. Some signs and symptoms of ADHD is fidgeting, RLS, which is restless leg syndrome. That kind of means like you can't really sit still. You always got to be on the go. A lot of talking. You can't really stop talking. You always have to talk. Poor listening. Like you kind of just pick what you want to listen to. All of us do that, but ADHD does it a lot more. Or you're not organized at all. Not at all. You can be easily distracted, like something, bad time management. You're never on time. You don't do anything on time. Yeah. You have a lot of angry outbursts. You're very mad all the time. Not all the time, but a lot more. More things aggravate you. You forget everything. You're very forgetful when you have ADHD. Causes. A lot of things that cause ADHD is abnormal activities in the functioning of the central nervous system. Also, if your brain was developed unevenly, that's another. Abnormal. If there's abnormal activities during pregnancy, that's another one. If you had head injuries, poisonings, if you were in a bad environment growing up. A lot of ways they test ADHD is diagnostic testing. They will look into see if there was any other conditions that are similar to ADHD that are present. They will do about 6 steps before they diagnose somebody. They will do an interview and they'll try to get the history of the child or adult. They'll do grading scales. They will do standardized questions. They will do a physical exam. They will look into everything. They will do a psych exam, and a conjoinite testing. They will get info from multiple sources, not just the person that wants you to get tested. Like if your mom wanted a kid to get tested, they wouldn't just take all the information from the mom. They would look into the grandparents. They would look into the aunts. They would ask them about it. They also have to see if there's any other, in the DSM-5 criteria, they have to look through there, see if there's any other disabilities that have the similar things that they think you have. Treatment. Treating ADHD usually involves medicine, education, skill training, and a lot of counseling, a lot of therapy to learn coping skills, to learn how to control the angry outburst, trying to organize your skills, to try to let others talk, etc. Meds, they'll give them stimulants to make them calm down. Non-stimulant, just to kind of make them there, but not like... A stimulant makes you calm down. A non-stimulant is just there as a precaution if the stimulant doesn't work. They balance each other out. They will give antidepressants, like anxiety medicine, stuff like that. When you have ADHD, foods you really want to avoid is sugar and colored dyes. Red dye is a no. Don't. Frozen fruits and vegetables is another big one. Sugar, soda, don't. Fish and seafood is a very big no. Sushi, energy drinks, of course. ADHD is basically people saying you have a big burst of energy. Milk is another one. Chocolate, eggs, tomatoes, since they're red dye, grapes and oranges. The prognosis, many individuals adapt to their diagnosis of ADHD. A lot of people managing their symptoms of like the RLS, they try to sit still, they try to do stuff with their hands to make them calm down. Some of the symptoms do reduce. They will get smaller as growing up if you're diagnosed when you're younger. But healthcare people are still trying to learn the best ways to manage ADHD when it comes to medicines, non-medical ways to help a child or adult. But yeah, that was my paper.